Are there surgical or non-surgical options? What actually helps? What does the studies or recommendations show?
We have to be clear that there's no cure for endometriosis, right? So, I mean, if someone is kind of telling you like, oh, this is going to take away your endometriosis or cure you, that's just not true and it's not validated. And then pretty much any non-surgical option, which is going to be a medical option essentially, is going to be palliative. So it just is going to potentially and hopefully treat and help you manage the symptoms of endometriosis, like the pain-related symptoms, but there's no evidence that it does suppress progression or like the growth of lesions of the endometriosis. So, I mean, certainly there are medications that you can take and use, like hormonal suppression, so birth control pills, but those are more likely to kind of help the symptoms as far as like the dysmenorrhea or the pain with your periods. You can use birth control pills, obviously, to skip your periods or to make your periods lighter. And so it may help in that way. Like an IUD, potentially, it could help by making your period go away. So it can help in that way. Anti-inflammatory meds like NSAIDs, pain medications, those are really only going to treat, the pain or the active inflammation potentially that's going on. And then the other medicines that are like the GnRH agonists and antagonists, there's kind of a time limit on those. So, potentially you could use those, but you can't really use them for a long period of time just because of the side effects. So truly the gold standard for treatment for endometriosis is excision. And that's surgical treatment where excision, I mean over ablation. So cutting out the endometriosis lesions to get to normal tissue is the standard of care for endometriosis.